study performed by the American Academy of Pediatrics, approximately 2.3 million men and women on active duty have deployed for the wars in Iraq and Afghanistan. 60% of U.S. service members have family responsibilities, resulting in 2 million U.S. children exposed to at least one parental wartime deployment in the past 10 years. Dr. Ben Siegel and Dr. Beth Davis have found a significant link with long deployment for military personnel with an increased risk of mental illness in their children. It is hard enough on us as adults to cope with the temporary leave of a loved one, as well as the mental and physical drain it puts on the soldiers themselves. So how would we expect this to impact our children? To children, wartime deployment is a period that may signal separation from a loved one, an increased sense of danger and daily uncertainty. CBS News also stated that studies they reviewed showed that 1 in 4 children of active duty service members experience symptoms of depression, 1 in 2 report trouble sleeping, and about 1 in 3 children of active duty military personnel experience excessive worrying. Other things that can cause a huge stressor on a child are how their parent returns from deployment. Some parents may return with physical as well as mental disorder. According to the study done by the American Academy of Pediatrics, it is estimated that more than 30% of returning soldiers have experienced post-traumatic stress disorder, depression, and/or traumatic brain injury. So what are things that pediatricians can look for in order to help the families, especially the children, cope with the absence of a parent who have been deployed? First, the doctor needs to understand the military lifestyle and assess the family based on the stages of deployment, which are pre-deployment, deployment, sustainment, and post-deployment. Pre-deployment, they need to discuss responsibilities and expectations of each family member, make plans and goals for the family and not just put their lives on hold, prepare for communication strategies, and decrease likelihood of misperception. Deployment, you need to initiate plans made during pre-deployment, continue family traditions, and develop new ones. Facilitate children's underestimate of the infinite nature of the deployment by developing timelines. During sustainment, you need to establish support systems, whether it's a neighbor, friends, religious groups, or family support groups. You need to continue to communicate with the deployed through email, phone, writing letters, avoid overspending, spend some time without the children, and always ask how the children are doing. Post-deployment, you need to take time to communicate and get to know each other again. Spend time talking to each other, lower holiday expectations, take time to make decisions and changes in routine, and keep your plans simple and flexible. Secondly, they need to understand how children at different ages handle this stress individually. In preschool, they're going to show feelings of anger, confusion, and guilt, and they're going to show this by clinging. They'll have demands for attention, they'll have sleep disturbances, they'll have guilt and irritability. When they're school age, they'll have the same feelings, plus sadness, worry, fear, and anger. They'll have rapid mood swings, regression, changes in behavior at school and with friends. And once they become adolescent, they'll show anger, sadness, depression, anxiety, fear, and they'll try to take charge of the family. They'll have an increased importance of their friendships over family, and they'll have loss of interest in non-communication. For certain cases, the pediatrician will need to handle care over to a qualified counselor to work with the families and develop a higher level of care. There are several places the provider can turn to in these instances, such as a rear detachment chaplain or family readiness group, or even a private counselor provided by healthcare. These options should be considered if supportive counseling is not working after 2 visits, if the pediatrician is unsure of their personal counseling skills, if the child's behavior has become extreme, if the parents are having a hard time personally coping, or if there is an injury or death of a parent. In closing, the study shows how important it is for parents and the pediatricians to remain active in their children's life, especially when dealing with a parent in the military. Dr. Ritchie said it best in an article posted on CNN.com. People express sorrow, fear, and depression differently over time. It may be that a child when young seems to do okay, and it's not until they are older they really realize what's happened. that they are willing or able to seek help for it. So it's critically important for the pediatrician to be following the child over the course of the child's growing up. Mental health experiences don't just go away or get better. They take months and often take years to fully resolve. That's it.